So I've been thinking a lot about my menopausal journey and the symptoms that I've had. And I can remember probably about 10 years ago, I started having these pains in the joints in my hands. And I was kind of quite convinced that actually it might have been something to do with holding my phone all the time or scrolling on my phone. And then I developed hip pain and a bit of pain in my shoulder. And I'm going to fast forward to today, and it's only really in hindsight that I realized that that joint pain was probably a perimenopausal symptom. So when people think perimenopause, they often think about hot flushes and night sweats. And although those symptoms are common, they're actually not the commonest symptoms. And for some people, they're not even the most debilitating. And you might be surprised to know that at least 50% of women who've been surveyed will say that they had significant joint pain or discomfort in the perimenopause or postmenopause. So I wanted to kind of have a little think about why that might be and what is the contribution. So if you think about it, in the perimenopause, estrogen levels are on the whole trending downwards to end up virtually at nothing, but there's definitely spikes along the way. And what we know is that estrogen is actually a powerful anti-inflammatory, and therefore it's like someone removing your own natural anti-inflammatory. So first of all, there seems to be a lot more inflammation begins to occur in women's bodies, and in one place that is in our joints. The other thing that happens in the perimenopause and postmenopause is because of those low or no estrogen, we really start to lose a lot of muscle mass. And although we think about that in terms of big muscles, and obviously whenever we start to lose muscle around, the legs and buttocks and things, that's going to certainly impact your hips and pelvic girdle, or around your shoulder, but it can also impact the smaller muscles in the hands and things as well. So we know that muscles and joints work very in synchronous, and they need each other, and we need our muscles to support our joints and vice versa. So there's probably an aspect of the joint pain that's related to that. And then the third thing that's probably contributing a lot is that we know, as I've told you before, there's estrogen receptors pretty much on every organ and every cell type in your body. And what that tells us is that we actually need estrogen, and that also includes our cartilage. So we know that there are estrogen receptors on our cartilage. And what we know is that whenever women have low estrogen levels, it seems to really mean that the cartilage deteriorates. So whenever you think about osteoarthritis or wear and tear, what you get is bone on bone instead of bone with a cartilage sandwich in the middle. So you can see that in the postmenopause, you're going to get that deterioration in cartilage, and therefore you're going to have a lot more of that bone on bone phenomenon. So as you can see, there's kind of a few reasons why people are getting joint pain. And then add on top of that, the fact that people are tending to feel fatigued and are probably doing a bit less. And also that we tend to gain, unfortunately, a bit of weight. And all of those things are putting more pressure on our joints. So I think what has been really apparent to me in my career, and I'll put my hands up and admit that I probably didn't even think about this for a long time whenever women in their 45 to 55 mark or younger were presenting to me with joint pain. In our mind, it's very easy as a doctor to jump immediately to think, gosh, have they got some autoimmune arthritis? Have they got rheumatoid arthritis, or have they got arthritis? Or often women will get a label of having a condition called fibromyalgia. And I do just wonder out there how many women are out there with one of those labels who perhaps would have benefited from having some hormones, or someone explore whether it actually was a hormone-related condition. Now, I will stress that it is important that you do go and see your doctor, and we don't always put all symptoms down, well, it's just the perimenopause, because of course we don't want to miss important things. Like, it is really important that we know if you've got rheumatoid arthritis or psoriatic arthritis, which is a type of arthritis that people with psoriasis can get, because that can cause real and permanent damage to your joints, and you don't want to miss that. So it is important that we rule those things out. But I think certainly as doctors and as patients and as sort of friends and family, if you've got someone who's having a lot of joint pain or feeling a bit of discomfort, and even if they do see a doctor, a general practitioner, or a rheumatologist or an orthopedic surgeon, just to ask the question, like, could this be my hormones? Because what I find is that whenever I have put women on some hormone replacement therapy with some estrogen and sometimes with progesterone, you get like an almost instantaneous relief of this joint discomfort. So many women will come back, and I usually check up at 4 weeks and then again at 3 months. And usually by that 3-1-month mark, women are saying, my gosh, my hip pain is completely gone, or my knees aren't sore anymore, or my hands aren't hurting. I'm able to go back and, do my hobby that I had stopped doing because my hand was so sore. Like, I was thinking of a lady recently who is an absolute avid golfer. I've known her for 10 years. She's obsessed with golf. And she had actually given up golf because not only were her hands too painful to grip her golf club, but actually she had also got a horrible frozen shoulder as well. And we know that that's also connected. It's not always related, because obviously men can get frozen shoulders as well, but we know there's a peak of getting frozen shoulders in that age group as well. So there's definitely a hormonal element. So just next time you personally are having joint pain, or a friend or family member who's got the same, just have a little think about whether it actually might be their hormones causing it, because they don't have that lovely anti-inflammatory called estrogen floating around in their bloodstream. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.